Hey, today's part 2 is Dr. Tamara Beckford with your Caring Docs Telemedicine Urgent Care, where we help people, especially our small business owners and entrepreneurs, get to see a doctor quickly overnight, the overnight doc, so that you can successfully open up your business in the morning. So I treat you for all your minor medical issues. Now, today we are talking about COVID. We do a Facebook Live every Friday at 6:30. Last week we did it on COVID. It's roughly like 17 minutes long. Now I know you don't have 17 minutes to listen to my entire topic, so I brought it down to some bite-sized pieces, around like 2 minutes or so. And today's portion is about the signs and symptoms of COVID-19, right? So for COVID, one of the first symptoms that some people are noticing is the loss of taste and smell. So if you're in this portion of the pandemic, and you're losing your taste and smell, it's a great chance that you're probably developing the signs of COVID, right? COVID is a respiratory infection, so people will have coughing, you have some fever, some chills, minor aches. Some people also have just GI symptoms, right? So they have just nausea, vomiting, diarrhea, that with their fever, and they go and get tested, and yep, you're tested positive for COVID. So signs and symptoms of COVID during this time: loss of taste and smell. Great chance, yeah, you're probably at the beginning signs of COVID. Nausea, vomiting, are some atypical and diarrhea signs of COVID-19. I know it's weird because you're like, well, I just ate all this food and, I'm like, really feeling good and I'm having diarrhea. Like, could this be COVID? Possibly. Not like everybody that has diarrhea have COVID, but there's some atypical presentation, even though COVID is a respiratory virus, right? But the coughing, and it's usually a dry cough. So you're not like coughing up with like, bringing up like these crazy mucus. It's really a dry cough with this. So COVID, which is also called SARS, which is severe acute respiratory syndrome, because it, of course, attacks the respiratory portion, right? So I hope it helps understanding some of the signs and symptoms of COVID: fevers, chills, lethargy, respiratory symptoms, cough, and nausea, vomiting, diarrhea, and also loss of taste and smell, right? So tomorrow we will go over another portion of COVID, and I hope you will tune in to us. So I will also be getting the COVID vaccine on Thursday, which from today would be 2 days from today's viewing. Yeah, it's getting a lot closer. Another of my colleagues this morning tested positive for COVID, and we work the same shift. So it's getting really, really close. So you understand why I feel it's important for me to protect myself and my family from COVID. So I am going to get the COVID vaccine. I'm going to document after receiving it, and I'll document a couple of days of how I'm feeling and just be very transparent with you and let you know, because I'm pretty sure you guys want to know what's going on, right? So I will see you then. This is Dr. Tamara Beckford from Your Caring Docs Telemedicine Urgent Care. I'll see you guys tomorrow for our next small bite size about COVID-19. All right, take care. Bye-bye.